Maybe you saw, well, first of all, my name is Greg Livingston, just in case, well, you must know that. I've been studying and practicing Chinese medicine almost 20 years, and half of that time in China. So now I live in Shanghai, and I'm licensed to practice medicine in China. So I practice at a couple clinics there, well, actually one hospital and one outpatient clinic. And I specialize in internal medicine, just general medicine. So I see most everything except for some really specialized stuff. And then, of course, there's so many really good Chinese medicine doctors in Shanghai that if there's some case I'm not comfortable with, then it's very easy to find someone to refer to. Just the people in the next room are, my teachers. So there's always someone to get assistance from. So then today I decided to discuss respiratory disorders, primarily because I have a lot of experience with it and I'm good at it. And I think the main reason is because I live in China and the air quality is really horrific and people have tons of respiratory problems. So just from coughs that won't go away for months and months to asthma, bronchitis, sinus problems, all this kind of stuff. I'd say it's easily 20% of my practice is just treating this kind of stuff. So I've gotten pretty good at it over the years. And I studied it a lot. I read a lot of books about it and followed some old doctors in clinic with that. So I have some ideas about it. But I'm going to start out, and if this is too simple, we can just kind of quickly go through it. But I figured we could start with a review of the lung in Chinese medicine. Is that okay with people? You don't have a problem with that? Okay. Well, let me get my mouse here. It's better. So, of course, the lung in Chinese medicine includes the lung, the anatomical lung itself, right? But also, according to classics, it includes the nose and the throat. So we have a quote here from Yixue Xinwu, which is a Ming Dynasty text. It's 肺有二窍, means the lung has two openings. 意在鼻, which is one is the nose, 意在喉, which is the throat. Right? So lung, nose, and throat, at the very least. Anatomically speaking, the lung in Chinese medicine is really the whole respiratory tract. So it's various anatomical structures, but it's also physiological functions that aren't actually part of the biomedically defined lung, right? Like everyone knows that the lung commands the surface of the body, right? And the waterways. I mean, these are not even concepts in biomedicine. So the lung in Chinese medicine is at once more than, and even you could say less than, the biomedically defined lung, right? Okay. So the first principle of lung physiology is the lung commands qi, 肺主气, right? And this includes a number of components. So the first meaning here is that the lung is in charge of respiration. Okay. And then underneath this heading, this means that the lung absorbs the clear qi, or in Chinese we call qing qi. So the lung absorbs this qing qi from the air. And Neijing actually says that the lung absorbs qing qi, and then that goes into the blood, and then the blood is essentially, that's then real blood, right? In my idea, actually, qing qi is really just oxygen. It's oxygen and maybe some other things in the air that are kind of valuable, like plants emit some chemicals that are beneficial to people, and that's all qing qi. But probably oxygen is the main idea here. And then the lung eliminates the dirty qi, or there maybe is a better translation for this, but in Chinese we call zhuo. Zhuo means turbid, is another English translation. Everyone here can speak English well enough to follow me? Should I speak more slowly? If you have any question, you just interrupt me, okay?